Hello to my future nurses, Professor Fit RN, and I am here to do a quick short on testing anxiety. But first, I want to let you know that I'm new to YouTube and I'm trying to grow my channel. So if you don't mind and if you have been watching my videos or even liking my videos, I really appreciate it if you would hit that subscribe button to help me grow my channel. Once you do that, you will receive notification when I upload new videos. Testing anxiety is something that some students suffer from. So it is important to know that if you notice that you have testing anxiety, especially testing anxiety that is so bad that it is causing you not to get the grade that you would like in nursing school, then there are some things that you can do to try to take care of that. One of the first things that you can do is speak with your professor. Ask her if there's any tutoring available. Secondly, you can try to help yourself by making your environment wherever you study at very similar to the testing environment that you test in. For example, if the classroom is normally cold and if you are not allowed to wear jackets, and if you don't use pen and paper, but you have to use a small dry erase board for your math problems, then when you're at home and you are practicing answering NCLEX style next gen questions, make sure that you make the environment at home cold, that you don't wear a jacket, and that you do have a dry erase board if you need it for any dosage problems. Try to practice as often as possible in this type of environment. Additionally, set a timer. Set a timer so that you are used to working under pressure. Do this repeatedly so that you can get used to doing this. My one question quizzes are designed to where the question presents itself. You have 30 seconds or 45 seconds to answer and the time just goes on. And at the end, the answer presents itself. So use that time if you have testing anxiety instead of fast forwarding to the end. Additionally, this is a little bit off topic, but if you are taking paper tests or paper quizzes of any kind, I strongly recommend that when you take my one question quizzes, answer it and sit there. Even though you may be confident, sit there. Now, why would I say that? No, I'm not trying to waste your time. I say this because when it's a paper test or either if it's a computerized test and you are allowed to go back to previous questions, what I find is that nursing students change their answers a lot. So you need to get comfortable with sitting there and being confident in the answer that you have chosen. Sometimes they can change it to help them, and other times they can change it so often that it causes them to fail. So go ahead and practice with that timer that's already built into my one question quizzes. Lastly, I want you to know that if you have tried everything, you have talked to your instructor, you have worked in a very similar environment to the testing environment, do know that if none of these things work, that I strongly suggest that you see your primary care provider, because there's no use in you failing nursing school over anxiety. Talk to your primary care provider and see what can be done to help with your anxiety so that you are successful at nursing school.
Don't forget to subscribe, like, and share.